Of Clinical Performance Excellence for Health Texas Provider Network, and we're here today to talk about adult weight and height. And people wonder, why is that so important? It is a piece of the big picture that your physician needs. We have to make sure that when we take a patient's weight and height that we do it correctly. You're going to need a scale. This is a weight scale. The most important thing about this weight scale is you have to know how it works. You have to make sure when your weights are in neutral that your bar balances in the middle of this space. That tells you that your beam is balanced. You need to make sure that when your patient steps up onto the platform that you're close. So the patient, if they should fall, you can catch them. You're there for their safety. The weights on the scale, the bottom weight, is in 50-pound increments. It goes 50 pounds each time you move it. The one at the top is in smaller increments. Before your patient steps onto the scale, you need to make sure that your scale has been calibrated. This should be done annually. You can put a call in to Biomed, or you can call a private company to come and calibrate your scale. Before your patient steps on here and they're ready, you need to make sure they've removed their shoes, all extra clothing. If they're men, they probably have keys in their pockets. Those things need to come out because you have to get an accurate weight. When that patient does step onto this platform, ask your patient, what weight are you expecting to have today? Once you know what their weight is going to be, say your patient is going to be 150 pounds or 152, you can set the bottom as close as you could get to what they've told you. Then as the patient steps onto this scale, you can modify it and zone in using the smaller one. And again, this will tell you what the patient weighs, so you need to be sure. If they're 153 pounds, you're going to set it to 150 on the bottom, and it'll be 3 pounds on the top. When your patient steps off, make sure that they're safe and they don't trip, because this is the time when accidents can happen. Some clinics have put bars behind their scales, some have put walkers around them, some of them make sure that someone is there for them. Don't be across the room when your patient is getting on and off the scale. Once the patient has gotten off and the patient sits down, you're going to want to prepare this platform for the next one, and you can do that very easily by just putting paper towels down. Set a paper towel down on the scale, so when the next person steps on there, you will remove the paper towel when they're done. People nowadays are not wearing nylons or socks, so you don't want someone to step on a platform and pick up athlete's foot or swimmer's wart, which are highly contagious. At the end of the day, when you're finished and you've thrown your towels away, your paper towels away, just take your cleanser, whatever disinfectant you use, and spray your platform. Let it air dry. Disinfectants work by drying in the air, and it takes about 5 minutes to kill the bacteria that we carry on our feet and on any surface. Now, you're going to have your patient step up here. Maybe your doctor just wants the height today. Your patient, once again, has to remove their shoes. Most patients like to stand on the scale with their back to the scale. You're going to raise the bar. Ask your patient to be quiet and not talk, because talking can actually wiggle the scale and they'll feel unsafe. The bar is going to go on the patient's top of their head and the flat surface. You will read your reading down here where the arrow is, and it will tell you, I set this one down, it's 163 inches. Once you're done, you'll just collapse it. And again, if the patient was barefoot, you're going to have to clean that scale platform off. Remember that taking a patient's weight is a critical part of the big picture that your physician needs. Even though we do it every day and we take it as a very simple skill, it's something your doctor needs, and they need the accurate information. If you have any questions, please contact me, Karen Wary.